only pregnant woman on this planet that is never gonna give birth, is never gonna go into labor. You're not, mama, trust me. I'm gonna tell you in this video why. Hi mama, welcome to my YouTube channel. I'm Ilenia, a midwife working currently in Europe, here to help you today to understand what is the due date. The due date is a calendar date that is given to you to mark the 40 weeks of your pregnancy. 40 weeks or 280 days, it is the average length of a human pregnancy. This is calculated by using your first trimester ultrasound that is usually done between the 8-10 weeks to the 12, with the conjunction of your last menstrual period. Why is that? While we're never gonna be 100% sure when you actually conceive that baby, unless it is an in vitro fertilization pregnancy, you can have the visual confirmation of your period. So you are more likely to know and to remember when was your first day of your last period. This, in conjunction with the ultrasound, allows the operator to plot your pregnancy and to be able to give you the famous due date. Already from the start of this video, you can understand that it is simply a date. That's what the due date does. It's not a date where we expect you to go into labor or to have your baby out already. It is simply a date that we use as a healthcare provider to plot your pregnancy, to make sure that your baby is developing correctly and according to the growth curves, and to be able to detect if there is something deviating from normal. And I don't think that this point is stressed out enough with you mamas, because when you are coming closer to your due date, I can definitely feel a lot of anxiety and fears and tension growing and coming up, and that definitely does not help to start your labor. To be able to understand why a due date is so irrelevant to plan and to estimate when your baby is gonna come, I'm gonna go back and tell you about what is the definition of a term pregnancy. A term pregnancy, broadly speaking, was in the past considered to be a pregnancy between 37 and 42 weeks. So there is actually a 5 weeks range, a 5 weeks time frame when your baby can come and consider to be term. However, this definition needs to be slightly corrected in order to differentiate these babies born in such a broad range, because you can understand yourself that a baby coming on its 37th week, 38th week, is not gonna have the same outcomes that a baby has in 42 weeks, generally speaking. A baby is considered early term when it comes between 37 plus 0 and 38 plus 6. It is considered full term from 39 plus 0 to 40 plus 6. It's considered late term from 41 to 41 plus 6, and then post term after 42 weeks. Pay attention to what I say. A baby is considered term, full term, from 39 plus 0 to 40 plus 6. This includes also your 41 week of pregnancy, the week where most mamas lose it because they think they're never gonna go into labor. Recent studies also say that it's basically normal to add 3/5 days on top of your due date to have a more correct estimation of your due date. Babies don't know when their due date is. They don't care. They stay happily in the womb and they decide when they have to come. We actually don't even know what really triggers labor to start. There are so many factors to take in consideration. We, of course, have some ideas on how the process starts, but we definitely underestimate the power of the baby in this process. And the baby feels what you feel. So if you are thinking that you're ready to go into labor, you have been trying all the natural methods to induce your labor, you've been bouncing on the ball, walking, having sex, eating pineapple, eating dates, you're reading everything that is possible and still labor isn't starting, well, ask yourself, are you really ready to go into labor? Because if you leave aside for a second all this definition that I've told you, the $1,000,000 questions here is, are you ready to let go of this pregnancy? So if you're watching this video and you're a few days past your due date or you're approaching your due date, try to put your mindset in a place where you ask yourself, am I ready? am I ready to let this baby go? Because your baby's gonna feel it. You're gonna produce different type of hormones. If you are not in a good place, if you are moving house, if you are just waiting to go on maternity leave, there are so many factors to consider that is gonna tell to your body to not go into labor. So regardless of how many methods you try, the first method to try is actually to talk to your brain and put yourself in a spot where you are able to let go this pregnancy. And if you're not, that's totally fine. As I told you, there is such a broad range in your pregnancy that you can wait a few days, and maybe labor is not gonna start that day, but it might start tomorrow. It might start after you've watched this video and you have confirmed that you're normal, even if you're past a few days after your due date. I think there is a lot of pressure surrounding the due date from us operators, that we kind of start to introduce the word induction when you are just 40 weeks, and also from people surrounding you, because they're asking you when are you due, like if there is an expiry date to your pregnancy, like if there is a best before. It's not like that. I would definitely tell to everybody that you're due actually a week after your due date, because then that is when most of the babies actually come. The percentage of babies coming on the due date, exactly on the due date, is very low. We're around 1 to 3%, meaning that only 1 to 3 babies every 100 babies will actually come on their due date. So don't worry, it's absolutely normal to go past your due date. Keep it in mind to prepare your life, to organize your nursery, to organize your maternity leave, and all your life in general. But don't put it in your brain like the date where you're gonna see your baby. It is absolutely normal to go over a few days after your due date. So again, let it go. Babies born by experienced mothers that have had already 1 or 2 babies before, they're more likely to go into labor before. If it is your first baby, you're more likely to pass your due date. Again, this is a general rule. If you're watching this video, again, hoping to go into labor today, don't worry, mama, you will go into labor. Your baby and your body know what to do. It is a process that nature has done over thousands of years. You're not gonna be the only one that is not gonna give birth. Yes, there is a percentage of women requiring something that is called a post-term induction of labor. That's after really 42 weeks. However, I'm aware that few places and hospitals are actually they want to induce a few days before the 42 weeks, and induction of labor has been proven to reduce fetal morbidity and mortality. So definitely recommended, but not until you are way few days past your due date. So don't worry, you still have plenty of time. Speak it out loud, tell your family and your friends and your doctor or midwife your concern. They're definitely able to help you. Speak it out loud, because when you say it out loud, you're speaking into existence, and there are definitely people out there able to help you and maybe to put you in that mindset that I'm talking about, that is gonna trigger something and your labor will start. Best of luck, see you next video.